Hello, everyone, and welcome to the presentation Itch, Itch, Itch with Dr. Steve Daveluy. Dr. Daveluy is an associate professor and program director at Wayne State University in Detroit, Michigan. He holds special interest in teledermatology, non-invasive skin imaging, skin of color, integrative dermatology, and complex medical dermatology, including HS. He chairs the American Academy of Dermatology Performance Measure Committee. He serves on the editorial board for the Journal of the American Academy of Dermatology and is building a growing body of publications of his own. Dr. Daveluy was also the past president of the Wayne County Medical Society. If you have questions for Dr. Daveluy about itch, please enter them in the Q&A section of the event portal. And Dr. Daveluy will respond to as many as time allows. Without further ado, please welcome Dr. Daveluy.
Thank you so much for that kind introduction, Deb, and welcome everyone. I wanted to start by just saying I am always in awe of the Cutaneous Lymphoma Foundation. They are just such a great organization, and these conferences are so useful. Every single patient I have who's newly diagnosed, I always say, visit the website, get involved with the Cutaneous Lymphoma Foundation, because it's just such a great resource for patients. And for most people, it's exactly what you need when you've been diagnosed or even further down your journey. So I just wanted to start by giving a shout out to them, because not every skin problem we treat has such a great organization to really help patients navigate their disease and their treatment. And it's just a wonderful thing that they do. So like Deb said, I'm going to be talking a little bit about one of the aspects of cutaneous lymphoma, which is itch. And as we'll see, it's a pretty common problem, but we are getting better at treating it, and we're advancing the way we treat it so that we can do a better job of it. Perfect. Clicker works perfectly. So itch. I think everybody kind of knows what itch is, but if someone asks you to define itch, it might be a little bit of a challenge. It's one of those things you kind of know what it is, but just to put it into words. So here's one of the definitions: is that itch is an unpleasant sensation provoking the desire to scratch. It's a very common problem that we face in dermatology. A lot of our skin problems feel itch because the skin has a lot of nerves, and they can feel pain, temperature, vibration, and then there's special nerves that feel itch that we'll talk about a little more. And then I just put on this slide too, pruritus is the medical word for itch, because of course we can't just use regular words. We have to have a complicated word for everything in medicine. So pruritus just means itch, and pruritic means itchy. So sometimes a dermatologist may say someone has a pruritic rash, and it means that it's itchy. So I just bring that up because as you're looking at things and reading things or listening to talks, you might hear people use the term pruritus, and it's just another word for itch. So as I mentioned, we're advancing the science on itch, and luckily people who are way smarter than me are doing some amazing research to learn more about itch and how it works in our body, and then that is leading to new treatments. So if you look at this diagram, you can see the brain, and then next to that, that kind of wavy thing is our skin. It's sort of a microscopic view of the skin, with the dead skin cells being that kind of hay color on the top, and then those pink and purple layers of the skin. And then you can see there's that kind of cordy root-like thing. That is a nerve in the skin. So it's one of the itch nerves, and we call them C fiber nerves. There's just different types of nerves, like I mentioned, that feel different things. So they start in the skin, and when something triggers a signal in the nerve, it then goes to the spinal cord and up to the brain and gives it the message that this spot of the skin is itchy. And I bring that up because there are different ways along that pathway that we can treat itch, be it on the skin, the nerves, or even the brain, to kind of help to soothe itch and relieve it. So what triggers the nerves to send that message? Well, there's all kinds of different things that can do it, and it can come from different sources. So usually whatever is triggering it sends a little message to the nerve, and they use little chemicals that sort of go over to the nerve and stimulate it and tell it to send the message to the brain. So the one that most people may have heard of is the first one in the little box to the left, called histamine. And you might have heard of it because we have medications called antihistamines, things like Benadryl. So histamine does a few things in the body, including it makes hives and swelling. So that's why when people have an allergic reaction, antihistamines can help block that histamine. But it also activates itch, which is why when people get hives, they're really itchy. So that's just one of the things. And you can see in those boxes, there are a lot of other substances that if they come into contact with the nerves, send a message to the brain to say it's itchy here. That also lets us know why antihistamines don't usually work great for certain types of itch. So sometimes we say itch is histamine mediated, meaning histamine is the thing causing it. And sometimes it's not histamine mediated. And that's been a big advance in recent years because we used to sort of only have antihistamines to treat itch. So for some things, some conditions, they didn't really work well at all. For some things, they worked great. So all of those different substances, they can come from different sources. They can come from the skin cells. So if the skin cells feel damaged or feel like they're in danger, they might release these substances to the nerve to send a message of itch. And they can also come from the immune cells. Because as you all probably know from today's talks or from your reading and learning about cutaneous lymphoma, there are tons of immune cells in our skin. Our skin is actually our biggest immune organ. And it's because our skin comes into contact with everything in the outside world, things we're allergic to, things that irritate us, things that are dangerous like bacteria and fungus trying to get in and infect us. So our immune cells are there to protect us and to be a first line of defense against all those bad things from the outside world. So those immune cells in the skin can also release these substances. So a good example is if you're allergic or say poison ivy, if you rub up against poison ivy, your immune cells react and that triggers the reaction that includes the itch. And in cutaneous lymphoma, you have normal immune cells in your skin, but you also have your lymphoma immune cells. So they can also release these substances because they're still immune cells. And we think that's one of the challenges of itch in cutaneous lymphoma is you've got these lymphoma immune cells in your skin, and they're already not behaving the way that they should be. And they have the ability to trigger itch. So they're just doing it willy-nilly, even though there's nothing there to tell them that there should be an itch. So it's almost like if you're having an allergic reaction, but there's nothing there. So it's kind of a complicated pathway. And the good news is the more research we're doing and discovering all these different things that are involved with itch, the more treatments we can come up with to block these things or decrease them or stop them from interacting with the nerves or the brain. So we have some treatments for the skin, some for the brain, some for the nerves. And it's just good to have a variety of treatments because sometimes things that work well for one person don't work so great for another one. So of course, we can't talk about itching without also talking about scratching. So why do we scratch when we feel itch? So we think that in terms of evolution, we evolved to scratch because something might be on us and biting us. So fleas or ticks or mosquitoes or other insects that sort of attack us and can cause us problems, trigger an itch response. And that tells our brain, go over there and scratch. There's something on us and you need to get it off of us. Or if you think of animals like a dog, when they have fleas, they scratch to try to scratch the fleas off of their skin. So it's great in those situations, but in most other situations, the scratching doesn't serve much purpose. The reason that the scratch helps the itch is because you've got those itch nerves sending their message. And we all know that multitasking doesn't work. Our brain can only focus on one thing at a time. And that's why distractions are distractions. So when we scratch, that triggers pain. And then the pain nerves start sending signals to the brain. And the brain can only pay attention to one thing. So it feels the pain. And that makes the sensation of itch basically go away. The problem with scratching is, number one, it can damage your skin. And sometimes you can open the skin up for an infection or cause yourself to bleed or cause yourself too much pain. But we also have something that's depicted in this slide called the itch scratch cycle. So you feel itch and then you scratch at it. And our body is always sending messages and receiving messages. So when you scratch, it sends a message to the itch nerves that what you're doing is important and you should do more of it. So they've done studies that show when you scratch, those itch nerves actually grow new branches, which means the next time that same thing makes you itchy, the itch is going to be worse because now the nerve is more ready for that itch and it sends the signal even more strongly to the brain. So that's the problem with the itch scratch cycle is you feel itchy, you scratch, that makes the itch worse, that makes the scratching worse, the itch worse, and you can see it just kind of cycles where the more you scratch, the more you itch. So just stop scratching, right? No. Anybody who has experienced itch knows that There are some times when it is so strong, you cannot just ignore it. You can't just block it out of your brain. And sometimes the sensation to scratch is so strong that people scratch in their sleep or without even realizing. They don't even know what they're doing. And you point out you're scratching right now, and they can't even tell that they were doing it. So while it is good for people to try not to scratch and hopefully use some treatments or some strategies that we'll talk about to soothe the itch without scratching it, I feel like it's also important to be a little bit compassionate and sympathetic to people when they do scratch. And that includes being compassionate to yourself. So don't be too hard on yourself if sometimes you can't resist the urge to scratch. You don't want to add an element of shame where now you feel like, oh, geez, I shouldn't be scratching. And it creates this negative self-perception. See, cutaneous lymphoma is already hard enough to deal with. The itch is stressful. The disease is stressful. So there's no need to add any kind of shame toward yourself when it comes to scratching. As long as you're doing your best to try not to scratch, you're doing your best, and you should be proud of yourself for doing your best. So hopefully these strategies will help you to not scratch, but don't be hard on yourself if there are times where you just can't resist and you have to do it. So talking a little bit more about itch specifically in cutaneous lymphoma, what do we know from studies that we've done? So they've done a lot of studies looking at large numbers of people with cutaneous lymphoma and asking about their itch so that we know more about it, well, how severe it is, when it happens. So some of the things we found from the research is that the itch tends to be worse in later stages of disease. So the more advanced disease, the higher risk your itch will be worse. Now, that doesn't mean for an individual person, it means a whole lot. So you could have mild disease and it could still be very itchy, or you could have mild disease and itch really isn't much of an issue. By the same token, you could have advanced disease or later stage disease that you don't get a lot of itch, or it could be really bad. But on average, when they look at lots of people with the disease, the itch tends to get worse in people who are higher stage disease. Itch is super common. As you can see on the slide, 60 to almost 90% of people report itch is a problem. So that's the vast majority of people with cutaneous lymphoma. And when they ask people, almost half said they're itchy right now. So that's kind of important as sort of a snapshot. Like when they're asking these people, they're actually itchy right this minute. The average score out of 4, with 1 being the mild or 0 being none, and then 1 being mild and 4 being the most severe, the average score was a 1 when they looked at people, all people. So that includes milder disease and more severe. And then when we asked about the frequency, about 17% of people said it's constant. They just get no relief. Almost 40%, it happens daily. And then there's a little typo on the slide. I messed up. It should be 22% say many times a week, and then 24% many times a month. So you can tell this is a pretty frequent thing. For some people, constant, for a lot of people, daily, but most people aren't going a week or a month without getting some itch. So it's a major problem in cutaneous lymphoma. Why do we care about itch? Because if you've ever been very itchy, you know it can drive you crazy. So in studies that have looked at the impact of itch, people who have itch versus people who don't, how does it change your life? These studies showed that moderate to severe itch. So if we classify it as mild, moderate, or severe, when they didn't include the mild itch, they just included the moderate to severe, they found that it impairs your quality of life, which is how much you enjoy your life and things you can do and you enjoy doing. It also impairs your sleep. And a lot of people will talk about their itch getting worse at bedtime. And we think there's a couple reasons for that. The first reason is, like I said earlier, our brains aren't good at multitasking. So during the day, you have more distractions and things that your brain can focus on and sort of forget about the itch or not pay attention to the itch. But when it comes time to lay down and go to bed, there's nothing else to focus on. You stop thinking about everything so you can fall asleep, and there's nothing to distract the brain. So then it just really focuses on the itch. Another reason that we think that happens for some people is because your skin is somewhat stable throughout the day for the most part. You put on your clothes and most of your skin is covered by clothing. But when it comes time for bed, your skin's exposed to a whole bunch of changes. You get undressed, which could expose it to a different temperature of air. Plus it removes the clothing, and the clothing might even rub as you're taking them off. Sometimes you take a shower before bed. You might put on creams or moisturizers before bed. And then you get into your bed and there's a different texture for your skin to be exposed to, your sheets, or if you wear pajamas, the temperature changes. So when you get undressed, it's cold. When you get in bed, it's warm. So your skin is picking up on all of these things. And sometimes those type of things can trigger itch. So that may be another reason that when it's time for bed, the bedtime routine might increase the risk of itch. And then, of course, you're trying to fall asleep and you can't because you're so itchy. They've also found it can cause depression and anxiety. So like I said, your itch can actually sort of drive you nuts. It changes your mood. It can also impair your sex life. And then they've shown it can even decrease people's productivity at work, which may be related somewhat to the loss in sleep and the trouble concentrating at work when you're itching all the time. So you can see itch is important. It impacts people's lives. It's not just a nuisance when it's moderate to severe. So what do we do to treat it? That's what everybody really wants to know. How do I get rid of this itch? So the most effective treatment is treating the cutaneous lymphoma because that's the root cause of the itch. If you can get your lymphoma under control and even into remission, then your itch will go away with it. So some of the things that we know are treatments for the cutaneous lymphoma that also help the itch can be topical steroids. Another gel that we sometimes apply is mechlorethamine or nitrogen mustard. And then phototherapy. So this is a picture of a patient entering one of the phototherapy treatment booths. It looks like a tanning booth, but it's a little bit different light that it emits. Just one second. And I apologize. My allergies are acting up and my voice, it gets a little scratchy when I talk too much. So it might be a little struggle, but we'll get through. So the phototherapy booth looks like a tanning booth, but it's a different type of light. So it can treat the cutaneous lymphoma and it can really help a lot with the itch. It's a great treatment option for some people, but other times it can be a challenge if you don't live near a physician who has a phototherapy booth. Sometimes you can get a home unit approved by the insurance. Sometimes you can't. And then the schedule, getting into the office to do the treatments can be a challenge too. Oh, sorry about that. And then another treatment that's kind of similar to the phototherapy is called extracorporeal photopheresis, where it's a procedure you go in for. They actually take blood out, add a medication to it that attaches to your immune cells, and then treat it with light. So it kind of treats the immune cells in your blood, and then they give the blood back. And that's been shown to be helpful in the itch as well as the lymphoma itself. And then because we know itch is a problem, when they've been studying new medications, including the trials they do to bring them to the market and make them available, they've started to measure itch. So they ask patients in the clinical trials about their itch to then see how well the medications treat the itch. So a few of the recent ones, we have this information. So vorinostat was shown to reduce itch in about 33% of patients. And alemtuzumab reduced the itch from a score of 8 out of 10 to 2 out of 10. So in some ways you think to yourself, well, why does it really matter if it helps the itch? It's more important it helps the disease, but it's good to know if it's helping that aspect of it, because in some patients, it might not help their disease as much, but it helps their itch, even though it's not helping the disease as much to clear up. So it's just good to have more information like that. And the more we know about it, and it helps to shed some light on the itch and what medications work better for it. And then I wanted to bring to your attention, naloxone lotion is actually in a phase 3 trial right now. So the phase 3 is the last step before a medication becomes available through the FDA approval process. So they're recruiting patients for this now, and there's information on the Cutaneous Lymphoma Foundation website if you're interested in learning more. And there was a recent talk, and the recording is posted at the website about the trial. And it's great that they're actually studying this as a treatment specifically to deal with the itch. Because we'll talk about it a little bit later and how naloxone works. And it might be a great treatment that actually is just for the itch and not even for the disease itself, which is nice to have. So that way we've got a treatment to target the itch. So if you're having a lot of itch, we can add that on. So other treatments for the itch itself, we do have some other ones that are more specifically targeting the itch and not so much the disease. And this is sort of our treatment ladder. So you start at the bottom and you move up. And if something doesn't work, you move up to the next step. So at the very base is gentle skincare or good skincare. And that is a really important thing for everybody. So we're going to take a little time to talk about that and what that means. And then there are topical medications like we talked about, including something I'm going to go over called wet wraps. And then we have some oral medications, and we already talked about the phototherapy. And then as a last resort, sometimes we use systemic steroids like oral prednisone, or there's some other steroids, and sometimes they're injectable. And the reason those are a last resort is they have a lot of side effects that we don't like, but they do work really well for calming inflammation down quickly. So it's kind of our last resort. If someone is really miserable, we might use a little bit of systemic steroids just to bridge us till we can get some other treatment lined up and going. But they're nice for sort of like an emergency. So let's talk a little bit more about good skincare. The average person who comes into the dermatologist and hears about good skincare finds out that they're doing a few things that are not so great for their skin. And unfortunately, it's just part of our life that nobody actually knows a lot of these good skincare tips. So these are really the foundation for treating your itch, and even for anyone with cutaneous lymphoma, even if you don't have itch, because these are things that can make your skin get more irritated and inflamed. So there's things that can make your disease worse. And we really want to get them all out of the way so that there's nothing that you're doing that could possibly make things worse. So one of the big ones is the temperature of the water when you're taking a shower. Everybody loves hot water because it feels so good. It is horrible for your skin. So we are always telling patients, keep the water as cool as you can stand it. The best is an ice cold shower, but not everybody can stand an ice cold shower. If you do want to go for it, there's a lot of great online resources about sort of ways to get used to it. And it takes about a month. I did it, and I now take ice cold showers every morning, and I'll never turn back. I love them. My skin loves it, but it's not for everybody. So if you can't go ice cold, at least try to go as cool as you can. Keep it at like lukewarm at the hottest. Keep the showers brief too. Because the skin, during your shower, you're stripping away some of the natural oils from the surface of the skin, which can increase the risk of irritation and skin dryness. And then you'll notice the next three are fragrance-free soaps and shampoos, moisturizers, and detergents. So the reason is because fragrances are very irritating for a lot of people's skin. And in the US, the way the labeling works for products is they just have to list the word fragrance. There are over 4,000 things that they use as fragrances. So you have no idea what's actually in that product as a fragrance, because all it says on the label is fragrance. So that's why we say go fragrance free, because you don't even know what's in there if we were going to say to avoid a certain thing, this or that. So most people don't know what it is in the fragrance that's bothering them. When one does, it makes it hard to avoid them. So often we'll see people come in and they're using a soap like Irish Spring that's just so smelly and full of perfume, and it's very irritating to the skin. And then some of the more recent laundry detergents that have that long lasting smell, the way that it does that is it actually leaves chemicals in tiny bubbles on your clothing. And when you move, those bubbles break and spill the chemicals onto the clothing to release more fragrance. Well, then it's also spilling it onto your skin. So unfortunately, things that we love, like nice scents and hot showers, are bad for our skin. So trying to eliminate these can really help. And then I also listed there avoiding dryer sheets and fabric softener. So the way that they soften fabrics and reduce static cling is to put chemicals on top of your clothes that stay on them. So that's why also they can make a fragrance kind of stick to your clothing. So if you are sensitive to those chemicals, every time you wear your clothes, they're exposing them to your skin. So what you can do instead are get dryer balls, or if you don't want dryer balls, just regular tennis balls work, and you just put them in the dryer, and when it's spinning around, they just kind of pummel your clothes so that they soften up a little bit. It's kind of the manual way of softening the fabrics. So that's our good skincare. The other thing I should mention is when you get out of the shower, because you've stripped away those natural oils, it's good to moisturize right when you get out, because it kind of combats some of that damage that the shower is doing to your skin. So what are some home remedies for itch? Some things that you could reach for right now or go to the store and get right now. I just mentioned moisturizer. Having dry skin almost always makes itch worse because the skin is more open to insults from the outside world. So like I said, we like fragrance-free moisturizers. Use them frequently. Use them right after showering or whenever your skin is dry. And if you think you might be having a problem with the moisturizer, talk to your dermatologist, because there are some really sensitive skincare, some sensitive skin brands that almost no one has issues with. Then ice can actually soothe itch because those same C fiber nerves that carry itch signals can feel cold. So if you're having a bout of itch and you just can't resist scratching it and you're at home, you can run to the freezer and grab an ice pack or a bag of frozen food and throw it on there, and you'll be surprised the itch goes away. Well, I mentioned my allergies have been bothering me, and sometimes my eyes get really itchy with my allergies. So if I'm at a restaurant and my eyes are getting really itchy, I'll grab my glass of ice water and just put it up against my eye. And that way I don't have to rub it or scratch it, and the itch just goes right away. So that is a great strategy for when you have a particular spot that's really bothering you. You can throw ice on it and it'll soothe it. Sort of in the same way, products that contain menthol or camphor can do that cool sensation. If you've ever rubbed on anything that has menthol in it, you feel that coolness. So in that way, they can soothe itch too. And then Pramoxine, which is in things like Sarna Sensitive, is an over-the-counter anti-itch that helps to calm some of those nerves in the skin. So it can be useful too. And then I put up a picture there. You can see that's a bent elbow. And right where there's that little dot is sort of right at the bend of the elbow. That's an acupressure/acupuncture point called large intestine 11. And so that is known in acupuncture and acupressure to be a spot that helps with itch. So it hasn't been studied in cutaneous lymphoma, but in eczema, which is another skin disease that's very itchy, they did a study and showed that putting pressure on that area of the elbow can help get rid of itch. So in the study, they had people do it twice a day. What I usually tell patients in clinic is I show them where the spot is, and I tell them if you kind of bend your elbow, it's almost like right there where the bend is. And when you feel itch, just kind of take a finger and push and rub on it and maybe make some small circles. And the spot doesn't have to be exact because you kind of move your finger around. And for some people, that can also bring some itch relief. You can do both arms, or a lot of times I'll tell people do it on the side of the body that's feeling the itch. And that can be a great way. And then bleach baths are another one that we're going to talk about a little bit in a couple slides. We'll really dive into more. So the wet wraps I mentioned, the basic idea behind wet wraps is you're putting on your medication or your moisturizer and then putting a layer of wet fabric over top. So that will help it boost the strength, and it helps it to feel more soothing and to get into the skin better. So the easiest way to do it at home is to use long underwear because they're made out of cotton, which doesn't irritate the skin, and they usually fit pretty snug. You get them wet with warm water and wring them out so that they're damp but not soaking wet. You put on your medications, and if you have areas of skin that don't have lymphoma, you can just put moisturizer on. Then you put on those wet long johns, and then you put on some dry pajamas or a robe, something to go over the long johns so that you're not getting everything in the house damp, and it helps you to stay warm. So sort of a wet layer and then a dry layer. And you can do that all night and just make sure that you're bundled up in your covers so that you'll stay warm even though you're damp. Or you can do it for a few hours if doing it overnight doesn't suit your lifestyle. But it is a really great. I usually tell people when you have wet wraps on, you won't have itch because it's such a soothing sensation. It is important to talk to your dermatologist about your wet wraps because they do increase the potency of the topical steroids you're using because it helps it get in the skin better. So depending on what steroid you're using, sometimes we won't use the most strong steroids because we don't want to boost it too much. So we'll use more like a medium one. But it's a good thing to bring up. There's lots of resources online for how to do wet wraps. And as you can see, we do them a lot for eczema. So the National Eczema Association has this little instructional, but if you just kind of Google, you'll be able to find other sources to kind of review how to do the wet wraps. And bleach baths. The concept behind bleach baths, the original idea was to kill some bacteria on the skin. So sometimes people think bleach bath, that sounds horrible, but we're just adding enough bleach to be about the same as swimming pool chlorine bleach. So you kind of don't think about it, but chlorine in swimming pool is chlorine bleach. And that's why it kills the bacteria and doesn't become a cesspool. So you take regular bleach, not the concentrated bleach, just the 6%. If you fill a full bathtub, you add half a cup. If you fill the bathtub halfway, you do a quarter cup. So a lot of times that's for like kids, we'll do less. You don't do a full bathtub. Or you can even make smaller batches. So 1 teaspoon of bleach per gallon of water. So sometimes people just have certain trouble areas and they'll mix up a gallon of bleach water and then just use gauze or a towel to kind of apply it to areas. If you do it as a bath, you're going to soak for 5 to 10 minutes. Then you want to make sure at the end you rinse off. So it's kind of like when you get out of a swimming pool and sometimes the chlorine makes your skin feel tight. So it's nice to rinse it off. And then you pat dry. And like I said, you apply your moisturizer. Usually you do it at least once a week, sometimes 2 or 3 times a week. And like I said, we originally did it because we thought, all right, we'll kill the bacteria on the skin. But interestingly, some of the newer studies have shown that it doesn't seem like it really does that much to the bacteria on the skin, but it still helps with itch, somehow reduces the risk of infection, so it must have some interplay with the bacteria, and it can calm down inflammation. The other thing where bleach baths can be really beneficial is it's your me time. You know, how many of us take a bath a week? Not most of us. So when I tell patients to take a bleach bath, I say, you know, you're going to need your family to cooperate with this. You're going to find things that you like to do for that 5 to 10 minutes you're in the bathtub, whether it's listening to music, reading a magazine, just relaxing. And that's going to be your relaxation time. So tell your family they can't disturb you. This is doctor's orders. You are taking a doctor ordered bath and they need to leave you alone and not bring any stress into that bathroom. If you want to light some candles, whatever, make it a nice little time. It's almost like a relaxing meditation. And so that's another benefit is you're taking a little time to stop and focus on your healing and sort of activate some of those natural healing mechanisms that our body has. So what are some of the medical treatments, the prescriptions that we do? So when we talk about treatments, we have first line, second line, third line. So first line treatments are the first thing we go to. They're usually the most effective and the safest and the least expensive and easy for people to actually get and for insurances to approve. Then if those don't work, we move to the second line therapies. And then if those don't work, we move to the third line therapies. So it's kind of like an order that we do things. So first line therapies include antihistamines. I talked a little bit about these earlier. You might know diphenhydramine, that's the generic name for Benadryl. Hydroxyzine, you might have been prescribed. Its brand name is Atarax. So like we talked about earlier, the itch in cutaneous lymphoma is not caused by histamine. So antihistamines don't actually help the itch. So why do they sometimes help and people like them? They cause sedation or for you to get tired. So Benadryl makes you so sleepy that your brain can't focus on anything, including the itch, and you just fall asleep. So some people will use them at bedtime, but it's not our favorite because it doesn't actually do anything for the itch. So you're basically just taking a sleeping pill. You might as well just take a sleeping pill instead of a Benadryl. There is one that's sort of an antihistamine, but not really. It's called Doxapen. So it's actually an antidepressant, but it also has a very strong antihistamine activity, about 10 times stronger than Benadryl. It also causes the sedation because it does that, but it might be able to help the itch because when we talked about the itch starting in the skin, going through the nerves to the brain, antidepressants can work on the brain to make the itch better, to kind of get the brain to not react to it so much. So we're not using them for depression, but just like aspirin is used for headaches and heart attacks, some medications have 2 uses. So Doxapen can be one that's useful and it might be a good choice. Other oral treatments, there's one called gabapentin, or there's sort of a newer version of it or cousin of it called pregabalin. And it's a medication we use for seizures, for pain, and for neuropathy, like from diabetes. It stops signals from the nerves. So when I describe it to patients, I tell them it kind of calms your nerves down and gets them to stop sending so many signals from the body to the brain. Sometimes we start with just a nighttime dose, but a lot of times you have to go up to a couple pills different times of the day. It can also cause drowsiness. So we're careful with it, especially at the beginning until you kind of get used to it. But it can actually be very effective for the itch in cutaneous lymphoma. And it's often one that I use with my patients when they're having itch that doesn't respond to the normal treatments, or they're using their treatments and the itch is still a big problem. We also use it. You might have heard of people being on it for the pain after shingles, because it's another, tells those nerves to calm down and stop sending so much pain. And then mirtazapine is another antidepressant that has been shown to be effective in cutaneous lymphoma. You take either 7.5 or 15 milligrams at bedtime because it does cause some drowsiness. One of the side effects that can sometimes be a big problem, other times not too much, is weight gain. So if people get the weight gain, obviously nobody wants to gain weight. So sometimes that's a reason that we don't use it. But it's another one that can be pretty effective for people. And then there's one called a prepitant. So prepitant is kind of interesting. It works on something that's called substance P, and that's one of those things that communicates between the nerves. So it blocks the receptor so that when that thing comes to communicate to the nerves, it needs to lodge into this little receptor to activate the nerve. Well, the receptor's blocked. There's something already in there, and it's the aprepitant. So then it doesn't work anymore, and the nerves don't get the signal. What it's approved for is actually nausea caused by chemotherapy. So we know chemotherapy can cause a lot of nausea. This medication helps to reduce that nausea, which then helps people to eat better. So there's a couple different ways to dose it. One of the hard issues with it is it can be expensive. So sometimes insurance issue is a coverage, and it can cause a little fatigue. But this is an especially good choice if you're having nausea, because then you can kind of kill two birds with one stone. If one of your treatments is causing some nausea and you take this aprepitant, it can help the itch and the nausea. But it has been shown to be effective for the itch, even in people who don't have any nausea. So it's not just for that. And then I mentioned a little bit earlier the naloxone that we're studying, and there's a cousin of it called naltrexone. And we've probably heard a lot about opiates because we've had this opiate epidemic going on with pain pills. So we have these opiate receptors in our brain and in our body that can feel pain and other sensations. And so naloxone and naltrexone block the receptors for the opiates. And you may have heard before, some people, when they take morphine, they'll get itchy. That's one of the side effects when these opiate receptors are activated. So this can help by blocking those. So again, it's a treatment that doesn't really help the lymphoma or the immune cells of the lymphoma, but it just targets the itch, which is kind of nice to have. And like I said, they're doing that study to see if we can get it in a cream form, because we've seen that it can be effective in pill form. So hopefully that's a kind of a nice overview of some of the things we do for itch. Just as a reminder, the foundation is good skincare, where you're not exposing your skin to hot water, lots of fragrances and irritating things. Moisturizer is a big part of that too. And then we talked about things like the bleach baths you can do, the ice or the acupressure point when you have some itch that you just can't resist scratching, things with menthol or pramoxine that are over the counter. And then some of the prescription pills that you can talk to your doctor about if you're having a lot of itch with your cutaneous lymphoma. And with that, we have lots of time, hopefully, to still have lots of questions. So I'll open things up. And if you have questions, Deb will help to relay them to me.
I sure will. Thanks so much, Dr. Daveluy. That was really informative. And we do have some questions. Speaking of moisturizers, are there any downsides to using vegetable glycerin or castor oil for moisturizing?
No, there's actually been some studies. So there's different oils that we use for cooking can be good for the skin. Some are better than others, and some just haven't been studied as much. And then it's a little bit tricky. So olive oil is a good example. Virgin olive oil contains certain fatty acids that are very calming for the skin. So virgin olive oil has been shown to be good for the skin, but refined olive oil, in the process of refining it, they change those fatty acids because they use either heat or chemicals to refine it. And after it's been refined, then it's irritating to the skin. Another one that's been studied and been shown to be useful is sunflower oil. It can be helpful to the skin. So there's a couple of them that are good, and then some you have to be careful of. Castor oil and I guess vegetable oil would depend what it contains in terms of the different vegetables. But what you can always do for any moisturizer is try it out. And if you're not sure, try it in a small area of your body. Do that for about 2 weeks and see if you get irritation or if you notice that it's helpful, and try to just do one thing at a time. So that way, you know, if you get irritation, all right, the only thing new I've been using is castor oil. But generally speaking, oils are good for the skin because that's what our skin makes to keep our moisture in. They're especially good right after bathing, because when you take a bath or shower, your skin absorbs some water, and then you put a layer of oil on top, the water can't get out and it stays in there and it moisturizes it.
So right along with that, a question just popped in about what about coconut oil?
Yes, I was trying to think. There was another one that was studied, and it was actually coconut oil. So coconut oil has a calming effect on the skin. The interesting thing with coconut oil too, that makes it kind of a really nice moisturizer, is that The temperature where it goes from solid to more of like a liquid is right about our body temperature. So if you live in a climate where it's a little bit cooler and not hot all the time, or you keep your house cooler, you'll notice that coconut oil will actually be a solid if it's virgin coconut oil. So it'll almost be like butter consistency or Crisco. And then as you rub it on, it melts and becomes nice and smooth. So I love coconut oil because you kind of scoop it out as a solid, then it kind of really rubs in nicely. And like I said, it's been shown to have a calming effect on the skin too. So that's a great question.
Great. How does one balance the brevity of a shower versus removing the dead skin that sheds? MF seems to have made my skin shed ever so more than about a decade ago. I can see a clean white towel have a residue of brownish dead skin after a shower.
That's a very good question. And that is a big problem. The flakiness, the scale in MF can be one of the big problems for it. And what happens is the inflammation actually tells your skin cells to grow faster. And that's why you get more flakes, because normally we're all losing dead skin cells all the time, but they're just little fine dead skin cells. But the inflammation in MF and cutaneous lymphoma tells the skin to kind of turn it up and go faster. And sometimes that's a good thing. If we're fighting an infection, it might be good to sort of shed a bunch more skin and get rid of it, or some kind of parasite, knock it off. But it's not helpful in MF. So it's a little bit tricky. There's actually never been any studies that show getting the dead skin cells off is helpful. We kind of like to get them off so that they're not so messy. And we definitely want the treatments to reduce the flaking. Sometimes that's one of our signs that they're working, is you notice that you're getting less flaking of your skin, and then the redness goes away. So you don't necessarily have to make that a goal of your shower to remove the dead skin cells. At the same time, I understand not wanting to make a mess everywhere else. You know, you think, all right, let me try to get as much off as I can. But if the length of the shower isn't necessarily a problem if your temperature is lower. So that if you can bring the temperature down on your shower and make it lukewarm, then it's okay to be in there for a little bit longer. If you can't, and it's kind of on the warm to hot side, then you really want to keep it brief. Just think of like every second that hot water touches your skin is bad for it. So either make the water cooler or bring the length of the shower down. I will say when you go to cooler showers, they naturally are a little bit shorter because you don't linger in there the way that hot water makes you just stand there for a while. It also wakes you up though, so it's great in the morning. But yeah, so you don't necessarily need to get those dead skin cells off in the shower, but I totally understand why it can be a convenient thing to do.
Great. So we have another question, but we still have plenty of time, folks. So if you have a question for Dr. Daveluy, now's your chance. I am recently diagnosed with MF. NB-UVB phototherapy has successfully eliminated all patches, receiving weekly maintenance treatments once a week. I have been experiencing outbreaks of itchy hives only in the formerly patchy areas. Is this a common reaction?
That's interesting. That's not a real common reaction. So it would be a good idea to bring it up with your dermatologist. Yeah, that's not something we commonly see. Usually hives and cutaneous lymphoma are two totally separate processes. And hives can be caused by coming into contact with something that your skin's allergic to. So it could be possible that one of your treatments could be triggering the hives, including one of the creams you're using or a moisturizer. So that would be a good thing to look for. If there's a relationship, when I use this, I tend to get more of the hives. Interestingly, hives can be caused by sunlight and sometimes even light therapy, or cold or sweating, or there's a few other triggers for hives. Hives are interesting because antihistamines work very well for hives. So that might be one option, is to start taking a daily non-drowsy antihistamine like a Zyrtec or an Allegra and see if it blocks the hives. But I would definitely recommend you bring it up with your dermatologist, especially if you can let them see the hives. And hives are tricky because sometimes they come and go quickly. So another strategy is when you have them, take some pictures on your phone so that you can bring them with you, and try to have someone help take the pictures, because if you use the normal camera, that's the best camera on your phone. When you switch it to selfie mode, where you can actually see what you're doing, that camera is not as good a quality. So a lot of times if we see selfie mode pictures, we can't do as much. But when we see the other ones, our cameras, our phones are so great now that they take great pictures. And it's a good way to capture those rashes, because there is a chance that it could look like hives, but maybe it's not actually hives. Maybe it's a manifestation of the MF that just looks a little bit different. So I definitely say bring it up with your dermatologist so they can really make an assessment. If you're worried that they might not be there when at your appointment, then when you get them, take some nice pictures, some good quality pictures in a well-lit area, that are in focus and really show what's going on.
Okay. We'll give you just a second.
Oh, thank you. Sorry about that.
Not a problem. I understand. My allergies want to kick in too. So I appreciate I don't appreciate your pain. I feel your pain.
Very good. Yeah.
So we did have another question come in. What about the rebound factor after using ice cold to help with the itch?
Oh, sorry. That's a good question. And when I recommend ice, I actually tell people a couple things. I tell them you can use just plain old ice, like a ice cube. The problem is that then your skin gets wet with water. Sorry, let me get one more drink.
It's okay. Nope. We've got time, so
right.
You take care of you.
Thank you. Thank you.
Yep.
So when the ice melts and gets the skin wet, sometimes that can cause a little irritation. So generally, we don't necessarily see a rebound. It's not like the ice works and then you take it off and the itch comes right back. A lot of times it will soothe it the same way that scratching does. So you can actually put the ice on and the itch will go away for a while. The ice cube method is convenient because you can have ice cubes in most places. But like I said, it can get your skin wet. So a lot of times I'll tell people, if you're using an ice cube, make sure you put moisturizer on afterwards so you don't get dryness that then makes it itchy again. If you're using ice pack, you don't have to worry about that as much. But a lot of times you can soothe the itch and it will actually go away for a little while and kind of relieve. You'll get some temporary relief. It might not be permanent. It might come back after a little bit and then you can just put the ice back on. But as a rule, it's not one of those situations where you put on the ice and it only works while it's on there.
Okay. Well, I'm not seeing any additional questions. We'll give people just a minute. And I'm not seeing anything. So I'm gonna think we're good.
Sure.
So thank you so much for your presentation, Dr. Daveluy, and taking the time to answer the questions. We'll be taking just a short break, everybody, and hope you'll join us for our clinical Q&A panel after the break. So be sure to get those questions ready. Thank you again.
Thank you. Thank you, everybody.